Hi, this is Ken with Individual Health Solutions, and today I'm going to spend a little bit of time talking about Medicare and specifically the four parts of Medicare and how they interact with each other. Spend a little bit of time on signing up for Medicare and how you do that and when you should sign up, and then spending some time on the differences between supplements versus advantage plans because there are differences. So, Medicare has two basic parts, and the first part is Part A. Part A is considered your hospitalization coverage once entering Medicare. There are some other things that are included under Part A, but for the most part, Part A will handle your hospitalization coverage, and that's what people really consider and think of when they think of Part A. If somebody did not have secondary coverage, for example, if they did not have a supplement or an advantage plan, this is what they would be responsible for and what's passed along by Medicare. So for every 60 days, the Medicare recipient is responsible for a deductible of $1,600 for each hospitalization. So if I was in the hospital in January and then in May, that would be two different deductible windows or $1,600 two times. More significant would be if somebody was in the hospital longer than 60 days, it turns into a daily copay on the 61st day. And for 2023, the per day copay after 60 days of being in the hospital is $400. So this could get really expensive. And again, this is one of the first reasons why there are secondary types of coverages in place. For most people, there is no monthly premium for Part A. As long as the individual has worked and paid into Social Security and payroll taxes for at least 10 years, the Part A is no cost to them, and if they have a spouse, would be no cost for their spouse as well. And the fact that this is a no-cost coverage is sometimes why people will continue to work and have coverage through their employer plan, but sign up for Part A because it acts as secondary to their employer plan and there's no monthly premium for that. The second part of traditional Medicare is Part B, also known as medical insurance. And Part B will include essentially everything else except prescription coverage. So Part A is hospital, Part B is medical insurance, and so things like doctor visits and outpatient surgeries, as well as if someone has to have an MRI or a CT scan, really anything other than being in the hospital and prescriptions would fall under Part B. For 2023, there are two different costs that are passed along to the Medicare recipient. There's a yearly deductible of $226, and then there's coinsurance in the amount of 20%. So for Part B, approved services by Medicare, Medicare pays 80%, and the Medicare recipient is responsible for 20%. And this 20% has no limit, has no out-of-pocket maximum. And this is a second reason why someone will have secondary coverage once they become eligible for Medicare. Part B has a premium, and for 2023, what you're looking at is you're looking at the premiums based on income. And I'm going to spend a little bit of time here talking about how income is used and which years it's used to establish your premium. But for the most part, the first thing you would look at is, do you file a single tax return or do you file a joint tax return with your spouse? If you do, you would look at that column that represents that different filing status, and then you would look at the income level. Now, when somebody first applies for Medicare, Medicare will look back automatically 2 years. So if somebody is enrolling in Medicare in 2023, Medicare will use that individual's 2021 tax return to establish the income that's used in those categories. In many cases, when somebody applies for Medicare, they're moving from a higher income level, right? 2 years before could be working years, and possibly moving into retirement years going forward. And so Medicare does allow an exception for that individual to state their income going forward based on their retirement income, if that's the case. And so there are 8 different qualifying events that Medicare will allow the individual to state their expected income going forward to establish their monthly premium, as opposed to having the 2-year retro look back establish the premium. So in this situation, let's say somebody did have income that was higher than $194,000 filing a joint tax return. So let's say above $194,000 to $246,000 and they file a joint tax return, they would have a monthly premium of $230.80. In addition to that, there's an added charge also under their prescription coverage. And so in this particular example, they would have an added monthly charge of $12.20 on top of their ordinary prescription coverage. So the point is that if the income levels are higher than $194,000 for a couple filing joint tax return, there will be higher premiums for not only Part B, but an added surcharge on top of their ordinary prescription coverage. So when to enroll in Medicare? If somebody is wanting to enroll in Medicare when they turn 65, there actually starts an initial enrollment window 3 months before their birth month. So for example, if somebody's birth month is in July, April is the earliest that that person could sign up. So April, May, and June, the 3 months prior to their July birth month, they can apply for Medicare. And Medicare would go into effect on the first of the month that person turns 65. So in this example, July 1st. There'd be one exception to that, and that is if your birth date is on the first of the month, you become eligible for Medicare 1 month sooner. So July 1st birth date would move up the start date of Medicare to June 1st, and then that would just move up the initial enrollment to March 1st for that person to sign up for their Medicare. If someone signs up for Medicare on their birth month or after, there are delayed enrollments that would happen for their Medicare. So this is used when someone is wanting to sign up for Medicare once they approach 65. Doesn't necessarily mean that they should, and we're going to talk here in just a couple of slides about people that continue to work, possibly wouldn't want to sign up for Medicare in those situations. However, this is used if you intend to sign up for Medicare when you turn 65. So once somebody does enroll in Medicare and is in Medicare as their primary coverage, there are two distinct options that they have to really fill in the gaps, to supplement their insurance and add in prescription coverage. So the first option would be the arrow to the left, and under this option, what we do is we add on top of original Medicare. So original Medicare A and B would be the primary, and then we would add a Medicare supplement, and sometimes it's also referred to as a Medicare gap or a Medigap type of policy. So that would be the second part to this option. And then the third component would be that we add a Part D standalone prescription drug card. And so under this scenario, the individual is in original Medicare. So Medicare is their primary, the supplement is their secondary coverage, and the prescription card, or also known as Part D, handles their prescriptions. This option, the individual will pay higher monthly fixed costs, but will tend to have lower expenses out of their pocket when it comes to their healthcare related expenses or costs. Contrasting that with the arrow to the right, this would be the second option that somebody has to supplement and add in prescription coverage, would be to do something that's called a Medicare Advantage plan. And a Medicare Advantage plan, what happens is that the individual would be insured directly with an insurance company. The insurance company takes over the responsibility from Medicare, and so Medicare is actually put kind of on hold. And so the insurance company assumes the responsibility for not only the primary, but also the secondary, including the prescription coverage. A couple of things are different with this option. So the overall monthly fixed costs tend to be lower, but then there are out-of-pocket costs in the form of copays with out-of-pocket costs not to exceed under Advantage plans. And so under this option, the Medicare recipient will take on some out-of-pocket expenses when it comes to their healthcare claims or their healthcare costs. Whereas under the first option that we had talked about with the arrow to the left, they really don't have a lot of out-of-pocket costs, but they pay a monthly premium. And so what we want to do is we want to compare the differences for everyone that we talk to really identify the option that would be the most appropriate. And then finally, these are considerations that we review with our clients when someone approaches 65, and the questions that come up over should they sign up for Medicare or should they elect to remain under their employer plan. And so the first thing is, if someone is working past 65 and they have access to an employer-sponsored plan, is the employer plan primary? So under Medicare guidelines, if the employer has at least 20 employees in the organization, and that's not 20 necessarily that's enrolled in the health plan, but just 20 overall employees, and that can be a combination of full-time and part-time, then that plan would be considered primary, and the individual could elect to remain on that health plan and use that as their primary coverage. The second part that we want to look at is that if you're on a high deductible health plan, these are the plans that allow you to contribute into a health savings account. You want to make sure that that plan is creditable for prescription coverage. There are some high deductible health plans that are creditable and some that are not. And it's important that you maintain creditable prescription coverage as well. So confirm that with the HR department of the plan that you're insured under. The other thing that comes up is that when somebody signs up for Social Security, there will be an automatic enrollment into Medicare. And so sometimes people will elect their Social Security, potentially elect a spousal benefit under Social Security, and continue to work and have no intention of signing up for Medicare. And then a Medicare card will just show up in the mail. There is a way to return the Medicare or disenroll from that if that was not your intent to sign up. But it's important to note, enrolling or signing up for Social Security will trigger enrollment into Medicare. So Part A, if let's say somebody does not sign up for Medicare once they turn 65, and let's say at 67 they decide to retire and sign up for Medicare, what will happen is, of the two parts, Part A and Part B, the individual can dictate when Part B will go into effect. So for example, if I'm going to retire January 1st of a particular year and I'm 67 years old, I can say I want my Part B to start January 1st of that year. But my Part A will actually be retroactivated 6 months prior. So in this example, it would be retroactivated back to July of the prior year. And this is important because if somebody is contributing into a health savings account, they would need to stop their contributions into their health savings account to coincide with that retro enrollment. So let's use January 1st of 2023, for example. If that's the year that I'm going to Medicare and I'm 67 years old, I would want to stop contributions into a health savings account July 1st of 2022. COBRA insurance. So this unfortunately does come up where somebody leaves an organization and potentially the employer offers to pay their COBRA premium for a period of time, and it can be as long as 18 months. And the challenge with that is that once somebody reaches age 65, COBRA is not considered creditable coverage. So again, when somebody's working for an employer and they have 20 employees or more, that's creditable coverage. Once they leave that organization and then that coverage is offered under COBRA, it's no longer considered creditable in the eyes of Medicare. So that would not be a solution for someone who is 65 or over to remain on COBRA. And then finally, retiree coverage. So if you have retiree coverage that's made available to you, almost always the retiree coverage when someone turns 65 will become secondary to Medicare. So almost always you will need to sign up for Medicare when you turn 65 as your primary, but could most likely continue to use the retiree coverage as your secondary coverage. So these are the items that we would really want to talk about with someone once they reach 65 and their intent over are they going to continue to work and the different types of things that they would need to really make sure that they're taken care of prior to turning 65. We hope you find this information useful today. We would love to talk with you. There's never a fee to talk to anyone in our firm. You can reach us at ihswi.com. And you can also find our phone number there as well. We would love to talk with you, and thank you very much for listening. Hope you have a great day.